What has been trending that is just kind of really insane is like sunscreen contouring.
Oh my gosh, I
Yeah,
can't.
right?
It sounds like a good idea, but when you think about all the consequences of just the UV radiation in the areas that are unprotected,
Yeah.
it is really not worth it.
Remember, not the way I do. It's getting late September, and I still think about you.
Hi, I'm Dr. Jenny Liu.
Hi everyone, I'm Dr. Mara Weinstein. Welcome to Sensitive Conversations with Cetaphil.
Oh my gosh, I'm so excited, Mara. It's been such a long time since we've seen each other.
I know, it's
Like-
been a year?
Almost. Time flies.
It's crazy.
Yeah, I mean, Mara and I have known each other for a long time on social media, but can you believe the first time we met was like last year?
I know, and it was in the most unsuspecting circumstance. We were both on a trip to France.
Yeah.
And it was an international derm conference, and we happened to connect right away.
I know. So I'm so happy to be here to talk about all things skincare. And yeah, just really excited to talk about all these things.
Yeah, likewise. So let's jump right in.
Yeah.
So we're going to be discussing today what your derm wishes you knew to best help you prep for your dermatology office visits.
Yeah. So question for you, Mara. If you had a magic wand and could get patients to do one thing
Yes.
before their derm appointment, what would it be?
So there are so many things that I could think of actually, but if I had a magic wand and could simplify one thing about the visit, it would be that the patient comes with a clean face. It is so difficult to do a thorough examination, so, if we're looking for moles or if it's more of an aesthetic, cosmetic type visit, and the patient comes with a face full of makeup.
Yeah.
We really can't do them justice.
Yeah, totally agree. Or we would have you wash it off or wipe it off with alcohol wipe, which you probably would
Which
not.
nobody wants.
Yeah. And on the same line too, please come with your nail polish removed if possible. You can find things under the nails. I mean, rare melanomas can occur in your nail units. And
Exactly.
it's really hard to look at your nails and assess your nails if you got gel polish on, for example.
Totally.
I mean, for me too, along with that is a couple of things like you don't have to apologize for not shaving. We
I was
don't
going to
judge.
say, one thing we don't care about in terms of prep is if you shaved or you didn't. So that does not matter at all.
Yeah. And then I would say the other thing is if you have a rash that comes and goes, and it's always like something about making that appointment, that derm appointment, the rash,
It just magically
yeah, I mean,
clears.
how many times have you had the patient come to you, God, like, it's gone now, like now that I'm here at my appointment, but it was there like 2 weeks ago, a month ago. And so maybe taking a picture can help since derm is such a visual specialty. Having a picture that can show us, that way we may have an idea and help guide
Yes.
you on treatment.
Yes, and along the same lines with the rash that's gone away, if you want us to address something but you've picked at it, it's really hard for us to see the original version, if you will, of that spot. And so try your best not to pick at things if you truly want an assessment and help with that.
Yeah, 100%. And then the other thing is, I mean, how many times have you had patients come to you and ask about like skincare products?
All the
What to
time.
use, right? Or if
Yes.
am I using the right thing? So not that you necessarily have to bring in all of your skincare products, but knowing what you use, or at least have a list that you can bring with you. That way we can better help you with your skincare routine.
That's right. I actually don't mind if patients bring all of their skincare. It does take a little bit longer in the visit, but you'll notice that some of the skincare products don't actually have the ingredients listed on the bottle, right? So most of the ingredients are listed on the box.
Yeah.
So if they have it in hand, we can kind of look up ingredients and make sure they're using things that are right and appropriate for their skin.
Yeah, absolutely. And then lastly, I think one thing is maybe not a lot of patients appreciate how quick the derm appointment is.
That's right.
Most of our appointments are only 10 to 15 minutes.
Right.
And so just being aware of that and then maybe giving your dermatologist a little grace if
If they're running late. I know.
Not by choice, but probably because of just the complexity of some patients that may set us behind. And with that, too, it can definitely help us along by showing up on time
Yes.
to your appointment.
So, Jenny, one of our biggest worries in dermatology is melanoma, right? And so, what should patients look for to help discover whether or not they have a bad mole or a changing mole? And at what point should they come in and see a derm?
Yeah, that's a great question. I recommend that everybody, like after 40, 45, should just have a baseline skin check. especially if you have a personal history of tanning bed use, lots of sunburns, and more importantly, like a family history of melanoma. I think having just having a baseline skin check is really important.
Yes.
Because that can determine like the frequency too. And definitely patients that have a family history of melanoma should get their skin check more regularly.
It's
Yeah.
easy to remember too that that's about the time to get a skin check because we think about all of our other cancer screenings. So that's the time we're going to think about mammograms or colonoscopies.
Yeah.
And so throw that skin check right in there with it. If you've never had skin checks, it is definitely the time to come in.
Yeah, and then your dermatologist can probably tell you like, come back in a year, come back in 6 months, or like you don't need to come back at all based on your history and what we see on exam. But I would say, like you probably use the ABCD rule.
We do.
Your patients,
Yes.
right? We should walk through that with.
It's such a great way to remember what to look for with a changing mole.
Yeah.
And so I get out one of those old school brochures and we kind of walk through the little pictures. But I can do A through C and then I'll pass it to you. But so A means asymmetry. So if your mole, one half doesn't look like the other, that is definitely a reason to give pause and come in and ask your dermatologist if it's something that you should be concerned about. B stands for border. So often I say if it looks like a puzzle piece, so the borders are sort of jagged and irregular, definitely a reason to come in. And C is color. So if your mole you noticed was brown and then it turned black, or even if it started dark and it turned red or colorless, right? So it can go the other way.
Right.
That's always a good reason to come in and have your moles evaluated further.
Yeah, great. And then D, the diameter. I mean, we say like the cutoff is the tip of a pencil eraser, so about 5 to 6 millimeters. But I love all of those. And then I also add an E, evolution. So the mole, even if you had it for a long time, but somehow it's changing really quickly, changing to those kind of signs that you mentioned, those would be a little more concerning. And then like if you have a new mole that's coming on quickly, and then I use the ugly duckling sign too.
That's right.
Yeah. Do you?
I love the
Yeah.
ugly duckling sign. And I think it just resonates with patients. So essentially, if you're looking at your body or doing a body scan and you notice that one mole just doesn't look right, it doesn't look like the others, it's the ugly duckling, then that's definitely reason to come in and get your skin checked. It's also important to think about examining your skin once a month on your own, right? And so this is when you're going to be looking for the ABCDEs of melanoma. And so I like having patients do like a calendar reminder. Everybody uses their phone. And so maybe the first of every month is self skin check day.
Yeah, I love that.
And so you get in your bathroom, get a little handheld mirror,
and-
look behind, maybe
Yeah.
call in your spouse or a child, I was going to say. Maybe not your child.
Hard to see areas.
Yeah.
Yeah, because like sometimes you don't even know what type of moles that you make, and it's obviously hard to see on like our back of our legs, our buttocks. And so yeah, I love the ugly duckling sign too because it kind of gives patients like what to look for because some people may just have slightly moles that don't follow the ABCD rules, but that's
Right.
them at baseline, and all of their moles look that way, that's just uniquely you. And then if there's one that really stands out, then probably best to come in and have us take a look to make sure it's okay. Especially
Totally.
if it's changing.
Agreed.
Yeah. Okay, now we're going to talk about something fun. Okay, Mara, how often have you had patients come in, talk about like trendy products or crazy skincare products and wanting to hear your thoughts and just like, what should I be doing those trends that I'm seeing on TikTok, right?
Yeah, I mean, it is crazy. And more people are following on social media than you think. And it always kind of surprises me because someone will say, "Oh, Dr. Weinstein, I saw you talk about such and such on social media, but what do you think about the glass skin trend, or what do you think about beef tallow?" And so these are some things where you really have to sort of come to not the level of the patient, but sort of relate to them a little that it's a crazy wild world out there. And they're hearing so much, getting so much input from all different sources. And really by the time you make it to your dermatologist, it's that time to learn the truth. Or at least learn more about what we do know and sort of leave the things that we don't know out of the picture until we have more data.
Yeah, and it's so interesting now, and I do think because of social media, derm appointments have also become like a skincare consultation appointment. I mean, have you had, I've had quite a few
Absolutely.
patients coming in. They don't really have particular dermatologic concerns, but just say, hey, can you tell me these are the products I'm using, or my friend is using these products. What do you think? And help me build a skincare routine.
Yes, that's
Right?
so true.
Yeah. Which I really actually love, and because skincare is so personal, kind of back to what you're saying, right? It's, you really have to understand your skin, your concerns, and then seeing a dermatologist to help you build that routine appropriately and not always follow trends, because just because it's trendy doesn't mean you necessarily need to do it.
Right.
Doesn't mean that it will work out for you either. Yeah.
So I have a question. So what do you do with those patients who come in and they say, oh, well, I found this in my daughter's cupboard.
Oh my gosh.
And I started using this skincare, this prescription retinoid I found, and it's working great for my skin. Can you prescribe that for me?
So I actually don't have a problem with that.
Okay.
If it's working well for them.
Right.
I need to first make sure, like, what is the product and what are you trying to address? And then kind of basically going backwards and say, okay, does that make sense for you to use this product? If so, then happy to prescribe it. Like, often it's probably like tretinoin, right?
Exactly. A child with acne, and then they heard it was liquid
Right.
gold
Yeah,
and, tried it.
Or the other one is like topical corticosteroids, which for
Oh, yes,
eczema. And
that's
happy
true.
to give that for a prescription so that way you can have it to treat the eczema. But yeah, I think I just want to find out, like, why are you using this product? What are your concerns, and does it make sense for you to use it? Yeah.
Right. And the one big no-no with topical steroids is not applying them to your face, right? Your armpits, under your breasts. Those are all sensitive areas. And so if you are developing rashes in those sensitive areas, then if the topical steroid works, it's probably doing its job, but it shouldn't be used long term. So that's time to come in and sort of pivot to what might be more appropriate.
Yeah, so I mean, I think the takeaway message is that if you are using somebody else's topical medication, just see a dermatologist. And you don't need to like
Even if
make
it
an
works.
appointment tomorrow, but definitely like, don't use it for like 3-6 months and then go in, because you could be making things worse, like putting topical steroids on your face.
Or hydroquinone.
Yeah.
Right? So there's bleaching creams. There are some creams out there that actually can make conditions worse.
Yeah.
So just, again, like you said, take away, see your derm, ask questions when you need to.
Yeah, I think definitely, like, if you have any skin concerns, certainly it sometimes takes a while to get in to see a dermatologist. So just make that appointment. Doesn't mean that you have to suffer while you're waiting. And certainly this is where maybe skincare products can be really helpful over the counter to help jumpstart the concerns that you have. But yeah, don't see a dermatologist.
See your dermatologist.
Especially if what you're trying to address is not getting better and getting worse. Yeah.
That's right.
Yeah.
So I'm going to pivot a little bit to those TikTok trends, right? Don't believe everything you see. I feel like both of us probably spend a ton of our time on social media trying to debunk trends.
Yeah.
So what are some of the things that you've recently been debunking?
Oh my God, don't get me started. Where do we start with that? Well, I feel like what has been trending that is just kind of really insane is like sunscreen contouring.
Oh my gosh, I can't.
Right? So that is basically purposely applying sunscreen on your face and avoiding other areas and then going out and basically getting a tan. The idea is that where you have sunscreen, you're not tanning and then bronzing or tanning other places to get that contour effect that you would naturally get with makeup.
Yeah, I can't. It sounds like a good idea, but when you think about all the consequences of just the UV radiation in the areas that are unprotected, it is really not worth it.
Yeah.
So 1 in 5 Americans will develop skin cancer in their lifetime. And we can't neglect the most common areas like the face, the backs of the legs. And so any sort of contouring with sunscreen or not using the right amount is going to cause more harm than good in that short term, in the long term. But in the short term, the benefit of just contouring, I mean, that's why there's makeup.
I know. So why? And then also the same thing, like along with that, like DIY skincare too. Like,
Yes.
why do all these things when you have like well-made products that works, that been tested for safety and efficacy?
Totally.
Like DIY sunscreen, for example.
I know. I mean, if you're going to make sunscreen, then it should be effective.
Yeah.
So if you're doing it yourself, then clearly you have some sort of consciousness or some sort of understanding of the benefit of sunscreen.
Yeah.
So why not find a product like those made by Cetaphil? Actually, Cetaphil has some of the best sunscreens out there that works for your skin, even if it's sensitive.
Yeah, and if you're worried about, like having reactions, then yes, going with a sensitive skincare brand like Cetaphil to help with, like those issues, but also knowing that the sunscreens are formulated for individuals that have maybe more reactive skin, and fragrance free and things like that, right?
Right.
And so, yeah, it's just there's so many nuances to making skincare products, particularly sunscreen, and so you really want to make sure that what you're putting on your skin is safe,
It's safe. That's right.
and effective. Yeah.
Exactly. And something you mentioned earlier, which I think is so important to just hone in on for a second, is the studies, right? And the efficacy. So we talked about safety, but what you might not realize is a lot of these products are actually thoroughly researched. And there's data behind them and clinical studies showing how effective they are.
Yeah.
So again, with DIY, we just don't have that. And the things that are trending on TikTok, that's one of the most common things us as dermatologists will do is look into the data and make sure that it's actually been studied and effective.
Absolutely. And then what other trends can you think of? I mean, right now I have a few other ones in my mind, but I'd love to hear your thoughts.
Well, one trend that I actually love, but I think we should just have some caution surrounding it, is slugging.
Yeah.
So, slugging means putting Vaseline or some sort of occlusive all over the face, perhaps on top of a moisturizer to just help lock in that extra moisture, especially in the winter time. But it can be really detrimental in patients who have acne-prone skin and aren't using the right topicals in the layering process. And can actually worsen acne.
Yeah.
So for slugging, I would say, again, it's something that at this point dermatologists know and can kind of guide you as to where to use these products or the more occlusive products.
Yeah.
Personally, I like it for the lips and under eyes. What do you think?
Yeah, no, I love that. I think this is, again, going back to a good trend that actually I think a lot of derms stand behind. And actually, this term slugging, like before it even became a thing, we as dermatologists have been recommending it in different ways. Like for eczema, like, I just tell my even babies with eczema, like petrolatum in the wintertime, right?
Totally.
But yeah, it's one of those things where it's a great trend that are supported by a lot of derms, but it doesn't necessarily mean that it's trendy. You have to do it, or it's the right one for you, first of all.
That's right.
Yeah, and I actually really love slugging, like you mentioned, like in just areas. You don't have to do it all over. And I actually love it like once in a while, especially in the wintertime where I live. It's brutally cold.
Where do you live?
Right now, Minneapolis.
I bet Rochester is colder.
Yeah, right. So, is it? Oh, we just get tons of snow. You guys are colder? No way.
I think we're going to have to duke it out later.
I know, we'll have to figure that out later. But it's a great, it can be skin saving certain times of the year, or say if you overdid it with skincare products and you're having a reactive skin. But you have to be careful. It doesn't mean that it's you have to do it. And I agree, for oily, acne-prone skin, it's not necessarily the slugging itself, like petrolatum, but the fact that you may not be cleaning your skin thoroughly. You may be using other products than that petrolatum would occlude.
That's right.
Potentially clip pores.
It's just the whole process of it. It's not as easy as just slapping petrolatum on your skin.
Yeah.
So
100%. So 12-step routine, yay or nay?
An absolute nay for me. I'm a firm believer in simple is better.
Yeah.
You really don't need a 12-step routine. In fact, I had a patient just the other day who came in. She hadn't been in the office in maybe 2 or 3 years.
Yeah.
She said she had found a dermatologist out of the country who had prescribed her this 10-step skincare routine. And it was his products that he had formulated, and you had to abide by the whole 10 steps, and that she used it for the past 3 years and was here in my office purely because she was exhausted. And nothing was really working. So she still had all the same concerns, enlarged pores, redness, brown spots, like everything. And came in saying I give up. I need a simple skincare routine. And I'm sure that happens all the time.
Yeah. Skincare is very personal. I totally agree that simple is better. I think it's one of those things where if a 10-step routine makes you feel good, like there's a self-care component,
Self-care.
it's been working for you, by all means continue. But if you're like new and don't know where to start, you don't necessarily need that 10-step. I mean, the basics, right,
That's
are
right.
just, especially if you're young and healthy too, you don't actually need to add in all these other trending serums and actives and actually potentially make your skin more irritated.
That's right.
But like a good cleanser,
Yes.
a good moisturizer and sunscreen is
Sunscreen.
what everybody should be doing.
Totally.
And then on top of that, figure out what your goals are, what your concerns are, and then maybe add in few additional products to help address that. And really, that's it. Yeah.
I agree.
Yeah.
I like antioxidants, so I always recommend those for the age-appropriate patients.
Yeah.
There's so many different formulations
Yeah.
now that can be, right for different skin types,
Yeah.
for different skin concerns. So, agreed that it's personal. It can be a method of self-care, but when starting, just keep it simple.
Yeah, keep it simple. And also the thing I worry about is like when you're doing a 12-step routine, like are you actually even getting the benefits? You're probably diluting, they may be interacting. A lot of it might not even be penetrating through to your skin to have an effect. And then also that pilling where your
Yes.
skincare, because you're layering on so much, it's just like rolling off in balls. So that's another reason why to keep it.
I hate the pilling.
The
It's
dreaded
so-
pilling.
The dreaded pilling. By the time you get your sunscreen on, everything
right.
is
Right.
peeling off
Yeah.
in a way
Right.
in what we call pilling.
Yeah. And then you're like, okay, gotta wash my face, gotta start over again.
Right, exactly. I've done that too many times.
Yeah. All right, Mara, before we end, we have to make some recommendations of products, So
Absolutely.
we gotta share our
Yes.
personal favorites from Cetaphil. What are some of your favorites from their portfolio? Because they have a wide range of products.
That is such a good question. And luckily, I have one right here with me. This is a Cetaphil moisturizing cream. It's non-comedogenic. It's amazing for face and body. And I love it for winter, like the drier winter months.
Yeah.
I use this on my kids. I use it on myself. It's just so soothing. And I usually use it right after the shower where there's still little beads of water on my
Yeah.
skin. Don't dry your skin completely and then apply because your moisturizer is just going to sit on top.
Yeah.
When you apply when your skin's still a little bit damp, it'll absorb quicker.
Yeah.
And then in the case of children, they won't be like, oh my gosh, my pajamas are sticking to my skin. So that's something I hear a lot.
Love that hack on damp skin. And that is definitely a staple in our household too. Use it for face and body, for the whole family. I love it. And then going along with that too, I love this daily facial cleanser, the one that is more for normal to oily skin that
Yes.
suds a little. And this is not only a great cleanser to gently but yet effectively clean. I actually, in the wintertime, love it as like hand soap. Because
Great
it helps
idea.
to clean. Because the whole purpose of hand washing is just in the action of washing.
Right.
Which is why you sing like that 20-second song like Happy Birthday twice. It's really not the antimicrobial ingredients. And this one is, you can get that cleanse but without stripping your skin, especially in the winter. Because hand dermatitis is just like
So
in the winter
common.
so bad. And,
So
and
bad.
yet it's the time that we wash our hands the most. So love it for that reason.
That's a good hack.
Yeah.
Yep. You might have one-upped me on
I
that.
know. Bring this home with me.
Bring this one
I
home.
I just ran out.
Have you seen Differin? It's
love
an over-the-counter retinoid. It's actually adapalene, which is the name for the retinoid. It's 0.1%, and it should be used for acne. So your teenagers, your adults, anybody who has the starting signs of acne, this is a great place to start, over-the-counter, available at your local drugstore.
I love that. And going along with that, one of my favorite products that I actually use regularly because I'm acne prone. I mean, how many times do you hear from patients like, I can't use BPO because it's irritating or whatever? And cleansers is the best way to get that acne fighting efficacy of like reducing the bacteria and inflammation. But this one is so gentle, like it's 2.6% micronized benzoyl peroxide.
Yeah, that was my question. What's the percentage?
Yeah, it's still effective
great.
concentration, but super gentle. And what I do is at night, I just leave it on for like the time, like I put on and then I brush my teeth. So I get that couple minutes of the action, and then when you rinse it off, it's still like effective, but you're not getting the irritation of leave-on treatments, and also you don't have to worry about bleaching fabric, your t-shirts, your pillowcases. And also a lot of people worry about benzoyl peroxide, like the leave-on treatments may interact with their like tretinoin. And a cleanser is still as effective, but you're not going to get that interaction. So I love this one.
Yeah, I agree. I love that you said to put it on sort of like a mask.
Yeah, kind of, yeah.
Because when you're using cleansers with active ingredients, you do want to leave them on for a few minutes. A few seconds, you brush your teeth.
Yeah.
But that'll really improve the benefit of it overall.
Totally. Okay, one last product.
Okay, one last product. I have to talk about sunscreen.
Yes.
So I can't tell you, and I'm sure you agree, but in clinic, it is one of the most common questions we hear is what sunscreen can I wear that won't break me out, doesn't smell, and that I can wear all day and realistically leave it on? Because finding the right sunscreen has to do with what feels right to you. Right. And so this is a wonderful product. It's the Cetaphil Oily Skin Oil Absorbing Moisturizer with SPF 30.
Yeah.
Let's say it again. With SPF 30. So not only is the SPF sort of high enough, but it's also broad spectrum, which means it blocks both UVA and UVB rays, and it's labeled as a moisturizer.
Yeah.
So I like to say you need to find a daily facial moisturizer with SPF.
Yeah.
And that way, I think with patients, it resonates that this is something I'm going to use daily. Yeah. And it actually has SPF in it, which is great.
So one-stop shop. And for oily skin too, I love the mattifying properties, but also Cetaphil has lots of great other moisturizers with sunscreen that's like suitable for like dry skin if you have that. But I recommend that all the time to my oily skin patients because they're like, I want a sunscreen that doesn't make me look shiny, and this is one that will give you like support your skin barrier, SPF protection, but also has mattifying properties.
So nice.
Yeah.
All in one.
All in one.
Okay, wrap it up. What's your last product? Tell us.
Relatively new launch, but I've been using this. Oh my God, I love it because it's the gentle exfoliating essay lotion that has a blend of acids, salicylic acid, mandelic acid, and PHA, so polyhydroxy acid. It's such a creamy moisturizer that's lightweight, great for face and body. So I actually even use this morning for my as a facial moisturizer to support my skin barrier, but at the same time you're kind of getting that gentle exfoliation to help with texture and tone. And it's just really nice. And it doesn't burn or sting, which is great, even if you have sensitive skin. If you're looking for something that will kind of slowly improve your skin texture and tone over time, must try.
That's a great product, really. And I think it's nice that you said it's great for sensitive skin and for all skin types and that you use it on your face. Because I've had some patients say, why do I need an exfoliating lotion? And you really hit the nail on the head. I mean, for all of those things. So
I also really love this for if you get those little bumps on your arms and legs, what people call chicken skin. Great to kind of smooth that over too. At the same time, hydrating your skin, which we know is kind of the cause of those little bumps on the skin.
So good.
Yeah, so good.
A must try.
Must try. Oh my gosh, we're at the end, Mara.
I know.
Time has flown by so quickly.
This is so fun. This has been great.
So good to catch
I
up
love
with
hashing all of these things out with you.
Yeah. What would you say is one take-home message that you want listeners and viewers to remember?
I would say it's so easy to get overwhelmed by skincare and by influencers and by social media. And so I would really stick to your trusted dermatologist for accurate, truthful, evidence-based scientific information about how best to care for your skin.
Yeah.
What about you?
Same. Mm-hmm. And also, please see a dermatologist if things are not getting better. At the end of the day, there are a lot of things that over-the-counter products can help, but dermatology is nevertheless it's a field of medicine, and many concerns are considered medical conditions like acne. And so, if things are not improving, please see a dermatologist to make sure that you're actually treating the right things and getting on proper treatment to help your skin at the end. So
great. We're not that scary.
And Mara, where can viewers find you on social media?
So I'm at Dr. Mara Weinstein on Instagram and TikTok. And then much to Jenny's credit, I just started a YouTube channel. She inspired me. And so I wanted to take education to just another level and have that long form format to share little pearls of wisdom with you all. So you can find me on YouTube too.
That's so great. Yeah, it's so hard to like give really good information in like a 30-second video. So that's why I really love being on YouTube too.
Yes.
And then you can find me at derm.talk on Instagram. And then I go by Dr. Jenny Liu, both on TikTok and YouTube.
Amazing. Follow her, subscribe.
Yes. All right.
And with that, thank you so much for watching and listening. It's been so fun to be here with everyone, and we hope we see you again.
Yeah, see you soon.
Remember, not the way I do. It's getting late September, and I still think about you.